We're lucky to live in a country with access to excellent healthcare. But when it comes to doctor's appointments and hospital treatment, we know it can be a challenge to understand the costs and figure out what you can claim on your private health insurance. Here's a breakdown. Understanding Medicare. In Australia, the government sets a fee for most medical services in the Medicare Benefits Schedule, MBS. But doctors can charge whatever they like for their services, and some charge more than the MBS fee. This is when you'll have a gap or out-of-pocket cost. If you have a health issue, your first stop is likely to be your GP. GPs. Some GPs choose to accept the set Medicare benefit as full payment. This is bulk billing. If your GP charges more than the MBS fee, Medicare pays the benefit set out in the MBS and you'll have to pay the rest. Government regulations don't allow private health funds to cover the costs of a GP appointment or any out-of-pocket GP costs. If your GP wants you to see a specialist, ask them to refer you to one who participates in HCF's No Gap or Known Gap scheme, known as Medicover. You can also search for one through HealthShare or the HCF website. This can help you minimise your costs if you need inpatient hospital treatment. Specialists and outpatient services. Like with GPs, the government has set an MBS fee for specialist appointments. Medicare will generally pay 85% of that fee. By law, health funds can't cover any out-of-pocket costs, so you'll have to pay the difference between the Medicare benefit and the fees charged by your specialist. It's the same for outpatient services. You're considered an outpatient if you aren't formally admitted to hospital, like a visit to the emergency department, x-rays, scans or lab tests, some same-day treatments or hospital clinics for disease management. Hospital. You're an inpatient when you're formally admitted to hospital by a doctor, and this is when your private hospital insurance kicks in, if you're covered for the service. Here's how it works for doctors or medical and hospital costs, as they'll bill you separately. Medical costs. If you need inpatient hospital treatment, ask each doctor, specialist, surgeon, anaesthetist, etc. whether they'll participate in HCF's Medicover scheme. If they agree, the maximum you'll pay is $500 for their services. Medicare and HCF pay the rest. Some doctors won't charge a gap at all. If your specialist and any other doctors involved in your care don't participate in our Medicover scheme, you'll pay the difference between the MBS benefit and their fees. Hospital costs. We have agreements with hospitals around the country to help minimise your gap payments. If you choose an HCF participating private hospital, we'll pay your hospital bills if you're covered for the service and have served any relevant waiting periods. You may have to pay an excess. Check your policy to see which level of excess you selected, if any, when you chose your cover. If you go to a public hospital, you may have out-of-pocket costs if you choose to be treated as a private patient. We understand that the healthcare system can be complicated, especially when you're feeling sick and just want to get treated. We're here to help as best we can. Contact us if you have any questions about your cover or if you're going into hospital and want to know more.